Hi everyone, this is Dr. Roy, a first year medicine resident. In this video, we'll be discussing about vitamins from first aid and few extra points from here and there in regards to your NEET PG or INICET exams. So this is the very first video I'll be posting on this channel. So if you guys find it useful or informative in any way, so please like, share and subscribe to the channel. And also please comment down your thoughts or any suggestions in regards to the videos or the upcoming videos. So this is a kind of revision video. I won't recommend this video for someone who is reading vitamins for the first time, but for revision purpose it's good. And for the ease, I have divided this video into two parts. So yeah, let's begin with the video. Thanks.
So now we will be talking about essential fatty acids. So basically we know that essential fatty acids are basically PUFAs, which is as mentioned here with the first day that PUFAs are PUFAs are actually polyunsaturated fatty acids, which means it must be having more than two double bonds. So that's what creates PUFAs, and PUFAs are basically cannot be synthesized in body, so that's why it is needed in our nutrition to be supplemented. And here are some examples in which we can find it, like the nuts, seeds and seafoods. So basically when you see about PUFAs are of two types. One is omega 3 and the other one is omega 6. So for an instance, we can say that omega 6 is much good kind of a fat which we need. Omega 6, we can give three examples of it. The first most important one is linoleic acid, which is mentioned over here. And as mentioned over here, arachidonic acid is also a type of omega 6. It's actually a 20 carbon compound which serves as a precursors for leukotrienes and prostaglandins, which we will be studying in acute inflammation. And the third type of omega 6 PUFA is gamma linolenic acid. So these are the types of omega 6 PUFAs, and the most essential polyunsaturated fatty acid is actually a very linoleic acid, because and it is obtained from safflower oil, important source of linoleic acid. And whereas in omega 3 we have linolenic acid, there's a slight difference in the pronunciation. Omega 6 is linoleic acid and omega 3 is linolenic acid. So in linolenic acid, omega 3 is also a good fat, of course, but compared to omega 6 is the most important one. When we go to omega 3, the examples are, first one is most important, which is DHA, which is also found in breast milk, as most of us know this, helpful for brain development of a fetus. The second one is very important, linolenic acid, and the third one is EPA. The full form is not very essential, but just for the record, it is eicosapentaenoic acid. So these are just the names of PUFAs, which are, Viva important, but the most important ones are the linoleic acid and linolenic acid, which is mentioned as over here. So what we know is the PUFAs are the good fats, okay? So it is in a way cardioprotective, as written over here, omega 3 cardioprotective, and it is also anti-hyperlipidemic. So in most of these treatments we can include PUFAs. But when we go to the trans trans unsaturated. This fat is also unsaturated, but this is trans unsaturated fat. It is on contrary to be a cardiotoxic or causes cardiovascular diseases by increasing LDL, which is a bad cholesterol, and decreasing HDL, and whereas this increases the level of HDL. So this was about the unsaturated fatty acids we basically talked about. So now we'll be continuing with vitamins, and I'll be a bit fast about the vitamins, because if not, then this video is going to be a bit lengthy one. I don't want that. So vitamins, we know there are two types of vitamins, fat soluble and the water soluble one are vitamin B and C, and the fat soluble ones are mentioned over here, A, D, E, K. I don't think we need any mnemonics for this. This is pretty basic. So of course the vitamin A, D, E, K are absorbed with the help of fat, so there must be a role of bile because it helps in emulsification of fat, pancreatic secretions, and also intact ileum, because we know ileum is where the fat gets absorbed most through the lacteals. So and also the toxicity is more common because fat gets deposited in our body. So of course the vitamins also can get deposited. So whenever we prescribe this vitamins, it is to be advised by doctors only, whereas in vitamin E and C we can take it as over counter, and people usually do that. So also if these are the fat soluble ones, when we have malabsorption syndromes like cystic fibrosis or celiac disease or any disease causing steatoria, basically the fat loss, so there won't be proper absorption of these vitamins. That's it for the fat soluble ones, and we will do each vitamin individually. But here we have the vitamin B complex, B and C complex, and I won't recommend any mnemonics for remembering the order. I just basically learned it by its initials, but there are many good mnemonics. Even you could search it on Google. I remembered it by its initial, like TRNP. That's the only four I need to remember, because later on it gets easy. So the first T for vitamin B1, which is thiamine, then TR for riboflavin, vitamin B2, N niacin, vitamin B3, P vitamin. There is no B4, okay? There is no B4, and this is vitamin B5, which is pantothenic acid, and B6 is also pyridoxine. So you can remember it as like TRNPP. The vitamin B6 we are sorted, and B7 everyone knows that it's biotin. For hair growth, normally people take it. And B9 is folate, and B12 is cobalamin, and vitamin B6 is ascorbic acid. So these are the water soluble vitamins, B and C complex, and here it is mentioned that it could get washed out easily from the body, except vitamin B12 and B9, because B12 is stored in liver for 3 to 4 years, which is quite a long time, and B9 for like 3 to 4 months. And in general, they have mentioned that vitamin B complex deficiency could lead dermatitis, glossitis, and diarrhea. We would see each symptoms specifically further on. And the coenzymes, this is important, because the coenzymes helps you to link these vitamins to the biochem cycles. So the first one, T for thiamine for TPP, thiamine pyrophosphate, and this is R, riboflavin, is associated with, you have to remember this in this order. Like first, TPP is quite explanatory, and then we have FADH, which we see in Krebs cycles, and then there is NAD. Basically this is something which you have to learn, because this is going to help further. And vitamin B5 is associated with CoA, which helps in transfer of acyl groups, and this is PLP. The full form is not necessary, we'll see this further on. So there is the dietary supplementation. In general, vegetarians or the vegans have deficiency of vitamin B12, iron, B2, or vitamin D. Basically, it is deficient in almost every Indian, but yeah, they have mentioned this commonly deficient in many diets. So basically, in Indian diet, it is quite deficient in vegetarians or vegans. Though we don't have many vegans in India, but still. And if you eat a lot of like gym rats, when they eat a lot of high egg white, the uncooked one, they just drink it. It has a compound named avidin. Yeah, it's written over here. They have avidin in it, which actually inhibits the absorption of biotin, vitamin B7, and the corn is associated with vitamin B3 deficiency. So now we go to vitamin A. They have like three forms: retinol, which is aldehyde; retinol, which is alcoholic form; and retinoic acid, which is acidic carboxylic acid form. So when we go to retinol, the aldehydic form is actually associated with the visual pigments. So when we have deficiency of retinol, it causes blindness, night blindness basically. And the antioxidants are vitamin A and E, and also C. So A, C, E are basically the antioxidants. So vitamin E is also over here, and retinol component is associated with visual pigments and also helps in normal differentiation of epithelial cells into specialized cells. Whereas the retinol part, which the alcoholic part is, the retinol part, which we think, okay, it is written over here, that which basically helps in the anti-aging formulas. We have like too many serums these days in the market, but so it is vitamin E, retinol. This is in the morning by first aid, which you can read if you want. It can also be used in treatment of acne, yeah, because on grade 3 acne is when we have like pustular acne, well, basically after the comedal stage, when we have pustular acne, we use retinoids for its treatment. So that's what they have written it. And the source of vitamin A is liver, animal liver, and the leafy vegetables. And vitamin A supplementation is needed in vitamin A deficiency causes measles. So in measles patient, we give vitamin A for the treatment part. Oral isotretinoin for severe cystic acne, all trans-retinoic acid. So this is important. It is used in treatment of acute promyelocytic leukemia, which is AML3 according to the last WHO classification of AML. So in that we used to use trans-retinoic acid as a treatment. So these are the forms of vitamin A available, and what are their uses? So we know that retinol with vision. Retinol is basically anti-aging, or you could also say it is somehow related to reproductive health. We won't go into the details right now. And the retinoic acid, we have learned it here that it is used in treatment of AML3. Yeah, so deficiencies are like very basics. Vitamin A deficiency causes night blindness, nyctalopia, dry skin and scaly skin, xerosis cutis, and dry eyes, xerophthalmia, conjunctival squamous metaplasia, bright red spots. So you can notice over here they have marked such a beautiful bright red spot. Sorry, let me erase it. You can see this easily over here. This is the bited spots, and bited spots are basically the keratin debris, foamy appearance of the conjunctiva, and then later the severe deficiency gets the cornea get involved, and there is keratomalacia, and there is some part of immunosuppression because it also helps in immunity. So I could also add a point which is important for NEET PG or INICET because it is included in that. WHO classification for vitamin A deficiency. So there is a grading, which is, you just have to go through this once and you will probably remember this. So there is XN, which causes the first stage, the night blindness. So this is the first symptom that patient experiences. Then there is grade 1A, conjunctival cirrhosis. Then grade 1B, B for Bitot. Bitot spots. So this is conjunctival cirrhosis. Once the conjunctiva gets involved, there is dryness, and then it later forms as Bitot spots, I mentioned before. Then grade 2 is corneal involvement, so corneal cirrhosis. Then later we have corneal ulcer formation, grade 3A, corneal ulcer, but it involves less than 1/3 of its thickness. Then we have grade 3B, which is also corneal ulcer, but more than 1/3 involvement of cornea. And then we have there is no grade 4, it is 1, 2, 3, and then S, which is, so there was corneal cirrhosis initially, drying of cornea, and then we had ulcer, and now after ulcer, what it does, like ulcer heals and it forms a scar. So there is a corneal scar, but we know cornea is important for our vision. So if corneal scar is not that a good scar, which we say, then we have grade F, which is xerophthalmic fundus, which could not be seen on naked eyes. Of course, we have to perform the retinoscopic examination. So this was about the WHO classification, and also in National Immunization Schedule. We have included vitamin A routinely. So for less than 6 months old baby, we give 50,000 international unit, but it's not given routinely. Okay, this is a treatment part. If you see a baby who is suffering from measles or vitamin A deficiency, then you give this dose. And if someone is more than 6 months, then it is 1 lakh international unit. More than a year-old baby, then it is 2 lakh international unit. Whereas in this immunization schedule, I got sideways. So in this national immunization schedule, if you see, vitamin A is given, first dose is given at 9 months, which is 1 lakh, of course, as we said this, 1 lakh international unit. And then later every 6 monthly we give 2 lakh international units of vitamin A till 5 years of age. Yes, so this was about the immunization schedule, and this was about the treatment part. And okay, there's also another point, how to give vitamin A. So vitamin A is given in a regime form, like initially on day 1 you would give the first dose, then on day 2 you would give the second dose, and then on day 14 you'll give the third dose. cases of deficiency, the treatment part of vitamin A deficiency. But in when you go to say national immunization schedule, if you see in our Anganwadis and everywhere, there would be a spoon, which used to be a Viva question when I was a third year student. That spoon would have like two markings. The shallower marking would represent 1 lakh international unit, which we give for 9-month-old baby, and the outer rim, if you fill it till the outer rim, then it would be 2 lakh international unit, which we give after 9 months old baby. Anyways, this was not important. I don't want to confuse you, but yeah, this is a Viva question. Here we go to the toxicity of vitamin A. So acute toxicity, which is not very important. I haven't seen a question about it, but yeah, this increased ICP because it causes a condition, not a condition, pseudo tumor cerebri. We know that vitamin A helps in differentiation wala part. Okay, so of course if it is increased, then it is going to cause a pseudo tumor like growth in the brain, which is not actually a tumor, it's just a growth which causes increased ICP and symptoms like vertigo and blurred vision, nausea, vomiting. We know these are the basic symptoms which we see after increased ICP, and ICP is increased because of this condition. Chronic toxicity causes alopecia, dry skin, and this, yeah. When we say in the deficiency part, dry skin, we have questions with image representing a kid's elbow like this, sorry for this visual, like it's too bad, but this is the elbow part. I hope you get this. There is small keratotic plaque, not plaques, bumps, which we usually say it as toad skin. So yeah, that is the dry skin we see. This could be just a spot area. Sorry to confuse you. Let me erase it. Yeah, this was a point which I remember, dry skin. So also in toxicity, also we see dry skin, scaling, hepatic toxicity, yeah, because it is fat soluble, gets deposited in liver, and enlargement, arthralgias, and idiopathic intracranial hypertension. Also, vitamin A shows teratogenic effects. That's why when we give this isotretinoin to a patient for acne, we have to be cautious. Like the washout period for this drug is 3 weeks, 2 months, because it is a teratogenic. It has a teratogenic property, so it interferes in homovox genes and cleft. So this baby is born with cleft palate and cardiac abnormalities. So therefore we avoid giving this to a pregnant patient, or also a patient who is expecting and who's trying to have a child. We tend to avoid this isotretinoin. And even if a person comes with your OPD with a history of she has taken isotretinoin, so you will advise her to wait for 3 weeks, but I would suggest you should wait for 3 months, because there's a margin, there's a range, 3 weeks by a month to 3 months. So it's better to wait for 3 months. So you would wait for 3 months so that isotretinoin would wash out through her body, and then she could conceive it. Otherwise there are high chances of teratogenicity at the baby. And this is what it is mentioned, that before giving isotretinoin or vitamin A, we should run a pregnancy test, and also advise the female any 2 forms of contraception before isotretinoin.